Good afternoon, everyone. Welcome back to our next session. So that's the keynote speech in this afternoon. Right now, I would like to hand over to our moderator, Professor Yi-Lun Tsai, for moderate the keynote speech. Dr. Professor, please.
Yes. Good afternoon, everyone. My name is Yi-Lun Tsai from the Department of Veterinary Medicine in National Pingtung University of Science and Technology in Taiwan. I'm going to serve as a moderator for the session of this meeting. I think it's very good to have this session because in these 3 days of meeting, we heard or share the information about the diseases in humans. But in these days, concern about the One Health, the relationship between animals and human beings, and also the environment. So I think cover the session about the animals is very important. So now I would like to introduce Professor Chen-Hsuan Liu. He's adjunct professor and former dean in Graduate Institute of Molecular and Comparative Pathology and Department of Veterinary Medicine in the National Taiwan University. In this session, he's going to talk about SARS-CoV-2 in animals. So that's welcome Professor Liu for this speaking.
Okay, thanks, Professor Tsai, for that introduction. I'm Chen-Hsuan Liu, Professor of Veterinary Pathology from the School of Veterinary Medicine, National Taiwan University. And today I'm going to present the so-called SARS-CoV-2 infection in animals. But the title is COVID-19 in animals because the COVID-19 is the disease name in human beings. But in animals, we don't name it. So we call the COVID SARS-CoV-2. From the title, frequently several questions we will ask. Do animals have their own coronavirus? Are they able to infect a human being? This is the number one question we try to be addressed. And SARS-CoV-2 transmission, everybody knows it's mainly human to human transmission. But how about animal to human, human to animals, and animal to animal? We are really concerned about this. And next, we are talking about a little bit the status of natural and experimental infection of SARS-CoV-2 in animal. Finally, I will briefly mention the animal model for COVID-19. Okay, in recent 20 years, a lot of human beings facing the emergent or re-emergent zoonosis. That is the big challenge and highly impact. So approximately about 3/4 of the human emergence the infectious disease are caused by zoonotic pathogen. And among them, 75% emergence zoonosis is from the animal, particularly wildlife. Why? Because the two factors is one is deforestation, the other is illegal the animals and the bushmeat trade. In addition to this, the other factors like we increase the human population and increase livestock population and rapid urbanization and climate change and change to the agricultural system and the trade globalization. So the deforestation and the illegal bushmeat trade probably is the main factors cause a lot of the emergence disease in human being. Regarding to the wildlife, and we are concerning the wildlife, particularly in the bats. Several disease viral zoonosis from the bats. As you see it here, bats can cause through the intermediate host, like host, cause the Hendra, and through the pigs, is the Nipah, and through the civet, SARS, and camel, MERS, and probably penguin or unknown the intermediate species to cause COVID-19. But like rabies and Ebola, probably do not need the intermediate host. Talking about the coronavirus, I mean, generally speaking, and host range and the main target organs, no matter in humans or the animals, of the host range, including mammals, poultry, and whale or dolphin. Main target organs is GI tract and the respiratory system. I would say that a lot of the collection for today's presentation, the information regarding the scientific literature, papers, veterinary group organization are contributed to this presentation. I really appreciate it, particularly in CDC, USDA, and OIE, WHO, all contributed this presentation. So now I summarize, update the coronavirus in human and animals. So here we see a lot of the disease, in particular in poultry. In the first is infectious bronchitis. This is the first coronavirus discovery in humans and animals. So veterinary, the field, has fight coronavirus almost 90 years. And poultry and turkey and dogs, we still have the respiratory and enterotic infection. And we will talk the SARS-CoV-2 later. And cats, they have the FIP, feline infectious peritonitis, feline coronavirus enteritis, and SARS-CoV-2. And pigs, there's at least six infections, including GI tract and respiratory, and as well the central nervous system. And cattle, bovine coronavirus infection, rats and mice to have murine viral hepatitis. And human, so far we have the 7 coronavirus in the human beings. In addition to that, tigers and lions and mink, particularly susceptible to the SARS-CoV-2, the infection, ferret too, and whale and dolphin has their own coronavirus, and others including horse, rabbit, ruminant, birds, non-human, primate, and bats. So a variety of the animals can be infected coronavirus, but they are few or not cross-species transmission. Okay, let's talk a little bit about the infectious bronchitis in chicken. This is kind of the first discovery of the coronavirus. This is an acute and highly contagious coronavirus in chicken. It can cause respiratory and reproductive infection. Some strains will affect the urinary system, particularly in the kidney. Okay. Fortunately, we have the live attenuated and oil inactivated vaccine to control the disease, but not 100% efficacy. So this is a clinical sign, open mouth, and this is a trachea. This is a kind of cast, and the swelling in the kidney, and the tracheitis. And the transmission route of coronavirus infection, I will say this is a general transmission, including the human and animals. Okay, first the digestive tract, the kinds of fecal oral transmission. This is including the feces, feces, saliva, and the wastewater. Okay, SARS-CoV-2 detected in Italy, Australia, and Spain. And the respiratory tract, like the air drops, everybody knows that. And conjunctiviral in infectious bronchitis is very popular. And milk in pigs, we have the transmissible gastroenteritis in pigs, but not found in human being. Semen, PED, plasma, and vertical, like the COVID-19. This is identified in Italy, 2 out of the 31 pregnant women. And on fetus and the placenta, we can detect the virus. And so far, we mentioned 7 types of coronavirus known to infect humans since 1960. That means the human being has fight the coronavirus since 1960, like almost 60 years, but less than 30 years than the veterinary field. The first 4 is kind of the mild infection, like the influenza or like the cold. But since 2003, SARS and MERS and SARS-CoV-2 leads to human to form the global pandemic, still the highly impact in economic traveling and lots of the things. So we are concerning the animals and SARS-CoV-2. So this summary is from the OIE and update data. So I will list the species, types of infection. Susceptibility is called none, low, or high, and clinical signs and transmission. Okay, the first, the minks, everybody will know that this is used naturally. Naturally is highly susceptible. Clinical signs, yes, yes. And between the minks, but we have to pay much attention that in recently, mink is only one animal species can transmit the virus to the humans. And the second is case, is natural experimental, is high, yes, clinical sign, but between the case also can be transmitted. And tigers and feathers, this is a very high susceptible. And Egypt fruit bats and tree fruit are experimental, is high and low. And macaque, that is a kind of the non-human beings for experimental, because it's very similar to the human beings. So these are highly susceptible. Clinical signs, yes. Transmission, yes. Raccoon dogs, this is experimental, high susceptibility. And dogs can be natural and experimental case, but very low, really low the susceptible. And the clinical signs, no. And the transmission, no. Probably they are very viral low in their bodies. And rapid and cattle, experimental, that's very low or no clinical signs. And domestic animals, including pigs and poultry, because this is very close to the human environment. This use the experiment inoculation. They are not none or low the infection, and no clinical signs, no transmission. And so, because SARS-CoV-2 is a notable disease, should be reported to OIE. So right now, in OIE documents, dogs, cats, tigers, lions, and minks can be naturally infection of SARS-CoV-2. Okay, let's talk a little bit about the clinical diagnosis of animals infected with SARS-CoV-2. I will say this is a very limited knowledge, very limited because we don't have the many cases. Okay, so from the limited knowledge, incubation period is 2 to 2 weeks. Range means probably 5 days. And current evidence, I mean the clinical signs, just like coughing, sneezing, respiratory distress, nasal discharge, and ocular discharge, vomiting, diarrhea, fever, and lethargy. And many of them are symptomatic the infection, just like a human being. And we talk about the mink. Mink right now in many countries, including the United States, Netherlands, they have thousands of mink died of SARS-CoV-2. You see the lung growth region are diffuse consolidation and dark red. And histopathology, we see very similar to the human pathology, such as diffuse alveolar damage, we call that, formation of hyaline membrane, formation of synthetic cells, and with type 2 pneumocyte proliferation. It's very similar. And recent news, we know about the mink and SARS. Minks are the only one animals known to have passed the coronavirus to humans. 214 human-associated cases documented in WHO, except to the initial spillover even from an unknown species. Right now, 6 countries have the cases outbreak in minks. SARS-CoV-2 variant, right now we are considering called cluster 5. That's a mutation. So to avoiding the mutation to spread to human beings, there are culling of the millions of minks performed to prevent further changes for the virus's spread. And everybody knows the level of diagnosis of SARS-CoV-2 in human beings. Very similar, we use the similar tools to detect the SARS-CoV-2 in animals, including how to take the samples, the procedures, agent identification, such as RT-PCR, RT-LAMP, virus isolation, virus genome sequencing, and detection of the immune system, immune response, particularly use ELISA antibody test or virus neutralization test. Because we try to find the intermediate host or reservoir in the animals of this kind of the virus, we should use know the diagnostic tool to find the intermediate host or reservoir. This is it's kind of not practical to use animal to inoculate the virus because of too many animal species. So the OIE encourage the member country to use serological test to trace the infected animals. So serological test to SARS-CoV-2 in dogs and cats. First, in China, they test 1,053 cases, all are negative. Also use the RT-PCR to confirm the result. And second, China use 102 sample from the cats and find 15 cases is ELISA positive, and among them 11 had a neutralization antibody. The other study from Italy, large scale, and total of 870 companion animals, that means dogs and cats. They find the serological positive 3.5% dogs and 3.9% cats. That means cats and dogs can be infected with SARS-CoV-2. And recently, we studied the paper, serologic survey SARS-CoV-2 for experimental domestic, companion, and wild animal. This paper excludes the intermediate host of 35 different species of animals. So all negative results of the ELISA antibody. This is from the almost 2,000 serum sample from the 35 animal species, including domestic animals, poultry, experimental and companion animals, and wildlife. So they need to do it again, dogs, cats, mink, tigers, and all are negative. Okay, in addition to serological test, several months ago, they have the paper studied use the computer to analysis the by comparative and the structural analysis of S2. They try to find the intermediate host. They try to classify 5 categories, like a very high susceptible is a human and non-human being, and high and medium, like the case. This computer speculation is not really reflect the natural condition. There's a lot of factors can be. That means not 100% match. Okay, and just 2 days ago, this is a very nice the paper. They use cell culture to predict what kinds of animals are susceptible. I think this is very practical. They use airway epithelial cell, so-called AEC culture, for a variety of animal species to assess their susceptibility to SARS-CoV-2. They use in monkey, cat, ferret, dog, rabbit, pig, cattle, goat, llama, camel, and 2 bats. But just only replicate efficiently in monkey and cat. That's a pretty match to the nature of the infection. And let's talk about the animal model for the human COVID-19, sorry about that. So these cats and kids, how a feline disease may help us unravel the COVID-19 associated with pediatric hyperinflammatory syndrome, because I know the children, very few cases, them adults, infected with SARS-CoV-2. But here, the two diseases, one is from the cat, we call the feline infectious peritonitis, we call the FEP. This is a very popular and very severe feline disease in cats. The first, most of the young animal or children. Second, start with GI tract. Third, the children will show the ascites and the pleural effusion. It's very similar to the feline infectious peritonitis. And also infections, monocyte and macrophages. And in cats, they cause the granulomatous vasculitis. And this is sometimes like a Kawasaki syndrome. And also overexpression of inflammatory cytokine, particularly in tumor necrosis factor alpha, interleukin 1 beta, and interleukin 6. And also lymphopenia possibly caused by mediated apoptosis. This is a similar situation occurring in the FEP. So, and finally, remdesivir is successfully being used the treatment of the FEP. So this is show the FEP, feline infectious peritonitis, and this is from the ferret, so-called ferret coronavirus associated disease. The two diseases is very similar, the disease mechanism, and shows here's the intestine, and here's a loss of the granuloma associated, accompanying with the intestinal wall. So I think this is probably pretty good the model of the COVID-19 infections in children. Okay, listen to the very interesting things is that because as you know, dogs are very smart and have the very good smelling. So in many countries like Helsinki and Germany, in United Kingdom, they use the dog as to sniff with SARS-CoV-2 the patient. This is in Helsinki. They put the dogs to sniff the COVID-19 the patients. Okay, that's a summary of the current study of the SARS-CoV-2 and animals. Number one, SARS-CoV-2 is mainly human-to-human transmission. Number two, naturally infection of SARS-CoV-2 in dogs, cats, tigers, lions, and other animals are really rare. So based on the limited information, risk of animals mentioned above, spreading COVID-19 or SARS-CoV-2 to people is considered to be low. SARS-CoV-2, but finally, SARS-CoV-2 can jump back and forth between the minks and humans. This is a summary from the current study of SARS-CoV-2. And precautionary measures, everybody knows that if people infected with SARS-CoV-2 should avoid close contact with the companion animals. And handling and caring the animals, basic hygiene measures should be always implemented. Okay, we talk about One Health. That is mentioned in early this century. But the concept 100 years ago, as in German, the Dr. Rudolf Virchow, everybody knows that he is famous for the pathology, for the fathers of modern pathology. And he said, between animals and human medicine, there is no dividing line, nor should there be. The objective is different, but experience obtained constitute the basis of all medicine. See, he talked about this very useful the message. So right now we are very popular, say one medicine, one world, and one health. And so-called one health, that means physicians and veterinarians who share their expertise can improve the medicine and health in all the species. Okay, this is the end of today's presentation. Thank you. And any questions are welcome.
Thank you very much, Dr. Liu. It's a very good presentation. I think all of us were updated from you about the recent articles and information about the COVID related information. And before we have other question, I think I have one question for you. And based recent information, we know there's some infection in minks, and based on the molecular evidence, is like maybe it's related to another clade, like clade 5. And do you have any information about how these minks get infected firstly, and what's the mutation possibly happened in this group? And is it possible to like make the molecular mutate or hybrid in that group and create another virus to get serious infection to humans? Is that, do you have any information about that?
Okay, this is a good question from the Professor Tsai. As we know, still right now, we still have limited information about the mink SARS-CoV-2. But they speculate first from the human with the COVID-19, and they work in the mink farm. They infected the virus to the mink. And after several months, the SARS-CoV-2 in the mink body, they mutated. So right now they have 5 different variants in Denmark published. And after mutation, they transmitted from the mink to human. They have the genetic evidence to show that is from the mink. The virus transmitted from the mink to the human. So this is just published 2 days ago from the Science. So right now, in the world, they are concerning the mutation really initiate the second wave of the global pandemic, or most important things is because right now the vaccine is developing. Is that what, I mean, it will affect the vaccine development. That means this probably the vaccine is against the transitional, the COVID-19, SARS-CoV-2. But how about the mutate? So these are the people's concern about that.
Thank you for your answers. And I continue with this question, since we don't have much information on the animal side. So I think from the news, we know that this mink in Denmark maybe need to be sacrificed for human beings, but right now they stopped doing that. So in your opinion, from this evidence and the information so far we have, how would you suggest for this situation? And also concerned about the animal welfare.
Okay, that's the big and good questions. Regarding the mink industry, before the outbreak of SARS-CoV-2, a lot of the animal rights and animal welfare supporters, they ask the main countries such as Denmark, Netherlands, Spain, and United States, and Portland, because they are the main country to produce the mink for farm. And right now, they find the very good excuse because the mutation occurring in the mink, we should stop the industry. So based on the government policy and avoiding the mutation to spread the human being, so they have to take the precautionary measures to covering all the, I think this is a big disaster, but they have to do that. Okay, so as far as I know, in Denmark, they claim 2024 to stop the older mink from the industry. So that is for the precautionary measurements. So let's wait and more the scientific evidence and see what can we do the next step. Thank you.
And here there's a mention below Bangladesh give a question for you, and they want to ask, do you think this animal infection with SARS-CoV-2 are sporadic, or they have any relation with human infection, like higher density of human infection could transmit it to animal?
Okay, thank you. This is a good question. Regarding to the transmission between the human and animals or animals. So from the scientific evidence, because as you know, global the pandemic of SARS-CoV-2 almost 1 year, I mean the 11 months. So we feel almost like the huge human population infected with, but we find less, like 100 natural infection. So that means the animals, including dogs and cats, and even the lions, is not the susceptible species, I mean, compared to the human being. But it means, why? Because the mink industry, they rest pretty close. That is in the crowded environment. So that's easily to get infected. But the dogs and cats is companion animals that individualized by the human being. So it's number one, human is a very close contact, and the mink farm is crowded condition. So easily, if the people get infected with SARS-CoV-2, then transmit the mink. And we have to learn if the virus successful infected the human or animal, they have three criteria. Number one, you have to enough the virus variant. Second, the host should have the adequate cells receptor, such SARS, MERS, such SARS, COVID-19, they use S2 as the receptor, but the MERS, they use DPP4. But in dogs and cats, they use APN. Okay. Number three, your immune system should be absent or invalidated. So the virus should through the 3 doors can get into the body. So probably like the dogs and cats, they don't have enough the S2. Like right now, the human compare. Why the Asian population and the European country, the infected people is not compared, disappropriate, because they think probably S2 in European or the United States, the people, maybe the S2, the quality may be less than the Asian people. Okay, maybe this is, and how about, I think this is a very good question. We can search the S2 the receptor. That's easy because we have a lot of the forensic cases. You can do So forensic pathologists, they do lots of the necropsy cases from the children, neonatal, and also adults. So we can use the immunocytochemistry to detect the H2 in lung tissue. That can solve some problem. Why some people are very susceptible to the SARS-CoV-2 infection, some are not. I think this is a very good study. Thank you.
Thank you very much for your detailed explanation for this answer. And I also have another question. Is there any documented evidence of human to animal transmission of SARS-CoV-2? Is there any documented information so far?
Yes, we have the scientific paper. I think just published 2 days ago or something. Just the 2 papers just mentioned from the scientific evidence to show the evidence that's the mink, that's the kind of reverse the zoonosis. That means from the mink infected back to the human being. That's definitely. And so I will mention that. So mink is only one species to transmit the SARS-CoV-2 from mink to human. Dogs, cats, lion, that's not.
Okay, so I think last question, just echo what I asked. How was your opinion about culling of animals, and is it necessary for public health measure?
Well, this is a really big question. It depends on what viewpoints the culling policy. From animal rights and animal welfare, the group, they 100% support the policy. Okay, because and based on because the human rule the world, from the human the viewpoint, I personally supported the culling policy, but you have to base on the scientific information. As you know, every day, every week, tons of the information regarding the COVID, SARS-CoV-2, they are coming out. You cannot easily digest all the papers. So, well, and I think different people has a different opinion, but I personally, based on the precaution measure and the animal-human rights, animal rights and animal welfare, I supported the policy. Thank you.
Thank you very much. Sorry to need you to to tell your opinion, and I think thank you very much for your presentation and your clear answer for our questions. So I think we're gonna stop here for this presentation. Thank you.
All right, we have come to the end of our 3-day conference. I thank everybody for staying with us over the last 3 days. So before we go to our closing, I would like to give the opportunity and give the time to the Director General of the Taiwan Centers for Disease Control, Dr. Chou, to announce the awards for the conference. Dr. Chou, please.
Thank you, Angela. And I will say we had planned to give out 2 awards from outstanding presentations. However, the score was very, very close, and we had a tie. So there are 2 second-place awards. The first one goes to Huang from the Master of Applied Epidemiology Program of Australia, for the presentation titled Investigating COVID-19 Transmission in a Tertiary Hospital in Hanoi, Vietnam, using social network network analysis. Congratulations, Dr. Huang. And the second place is Chen-Hsuan from the Epidemic Intelligence Program of Malaysia for the presentation titled Review of 5 years to 2014 to 2018 tuberculosis mortality in cattle Malaysia. How far are we in achieving the Sustainable Development Goal targets? Congratulations. And finally, the first place winner is Yi-Lun from the Master of Applied Epidemiology Program of Australia for the presentation titled In-Flight Transmission of SARS-CoV-2 During a Long-Haul Flight, Results from an Outbreak Investigation in Vietnam and Application for Future Air Travel. Congratulations. Congratulations to all the presenters for a job well done and to our prize winners.
The Minister, Taiwan.
Thank you, Dr. Chou. Right, so we are finally at the very end. Can I have Dr. Martyn Kirk to give us some final thoughts, please? Martyn.
Thank you very much, Angela. Well, it's a great privilege to be involved in this conference. I have been involved with the TEPINET network for around about 10 years, and I've loved it. It has been a great opportunity. I'm sad that people haven't got the opportunity to join together in Taipei this week, but I'm extremely glad with the quality of presentations I've seen, the engagement of the residents, the questions from the resident advisor. It's been really fantastic. I think, this is a conference at a very unusual time as well. It's one of the first virtual conferences we've had on field epidemiology. There's never been a time quite like this for field epidemiology trainees. Who would have thought a year ago that we would have had travel bans around the world, that we'd be doing contact tracing on thousands of cases, that we'd be running quarantine stations, isolating people who are infected, providing epidemiological reports, conducting investigations. So, and I think we've seen that during these 3 days. We've also seen that important work of communicable diseases and other non-communicable diseases is still going on, and it still matters immensely. One of the things that's happened in this time of COVID-19 in Australia is we've run out of epidemiologists. I don't know whether in the country, but in Australia, we've had a lot of clinicians have to go in, leave the hospital posting and go into the Ministry of Health and assist with running the response. So we've had infectious disease doctors, family physicians, academics, all sorts of people are in the public health response. And they have a need for the skills that you're learning. So I think as field epidemiology trainees, it's a critical time for you. I think it's a wonderful time to be an FETP fellow. It's terrible to have the suffering and misery of a disease like COVID-19 affecting our populations, but it's going to be continuing in its importance next year when we have changes in mobility restrictions. There's going to be continuing need for surveillance and outbreak investigation. And when we roll out vaccines, there'll be need to estimate vaccine effectiveness and adverse events and a whole lot of other things. So I just encourage you to get involved and jump in. And we're seeing that here. I just want to finish up by congratulating all the speakers that I heard. They were all absolutely fantastic. I'd like to congratulate the resident advisors on all of the programs who've done such a wonderful job coaching their fellows and helping them and working tirelessly behind the scenes. One important organisation that has done a lot of work here, which is behind the scenes, is Safety Net. And they're incredibly important for the two regions joined here in Southeast Asia and also Western Pacific. And we really want to thank Conchi and Conky for all of their work. Of course, the Taiwan CDC, we really congratulate you for your bravery in putting on a conference like this in a time of COVID, and we're looking forward to joining in Taiwan when we can. So, you know, the team in Taipei has been amazing. They have really managed this process incredibly well, particularly Juan, Chen and Angela. And I really want to express our gratitude from Tefinet to the Director of the CDC and other Ministry of Health staff. And then I'd like to thank the organising committee, who's also been really fantastic as part of this as well. So really big congratulations to the Taiwan FETP for putting on this conference. Thank you.
Thank you, Martyn. And some final thoughts from Dr. Murhekar in India. Dr. Murhekar, to you.
I hope you can hear me.
Yes, we can.
Yes. Good morning and good evening and greetings from India. And we are in the closing of this conference, and it is really my privilege to say a few words in the closing ceremony. First, let me talk about the nature of conference. It was an online conference, and everybody wanted to come to Taiwan to have a face-to-face conference. But because of COVID restrictions, this was not possible. But despite these restrictions, we had a wonderful 3-day conference wherein we had very, very good scientific discussions. And the credit for organizing this conference goes to conference organizers. And I want to congratulate the organizers, especially Taiwan Ministry of Health, Taiwan FETP, and SafetyNet for organizing this beautiful conference. Day one, we had country presentations, and they described the situation of COVID in their countries. And they also talked about the role of FETPs, the FETP trainees and FETP graduates in the response. And it was really incredible to listen to this presentation. And one thing which has come up very clearly is the importance of strong FETPs in the country in managing any emergencies, be it infectious disease emergency or any public health emergency. So the country needs a very strong FETPs, and I congratulate all the FETPs for putting a strong response to COVID. We also had a very good panel discussion on day one, where the experts provided a perspective to the pandemic from the point of view of an infectious disease specialist, of an economist, and an ethicist. And it was really a learning experience for all of us. So I again want to congratulate the conference organizers for this. The last 2 days, we saw 12 FETP presentations, and want to thank and congratulate all the presenters for making beautiful presentations. And special thanks to the award winners, the 3 award winners which were just now announced. I must mention here that the selection of abstracts was a very competitive process. And because of a short timeline, we had to, or short time that was available for the online conference, we had to only select 12 abstracts with 2 abstracts per country. So again, the scientific committee did a very good job. They selected 12 best abstracts. And again, I want to thank the conference or the scientific committee of this conference for selecting the abstracts and also carefully putting the agenda of this conference. Conky informed me that more than 600 participants registered for this workshop, and more than 80 participants registered for the pre-conference workshop. So I am very sure that all the participants, for all the participants, it was a very good learning experience. The last point from my side, as Martyn mentioned, COVID is going to be with us for quite some time, and we need to be prepared we need to continue to respond to this emergency. And current strategy for response revolved around testing, or around tracing, around quarantine, and around isolation. And as Martyn mentioned, we will be having another tool for responding to COVID, that is vaccine. We hope that vaccine will be available early next year. And I feel that the programs, FETPs, need to work with the ministries, the respective ministries of health, especially to identify priority groups for vaccination, because vaccine is not going to be available for the entire country. So we need to identify the priority groups. The programs also need to identify strategies to vaccinate these priority groups, and more importantly, document the entire process of vaccination, including the AEFIs, that is the adverse event following immunization. And this will not only be useful for the country, but also neighboring countries, countries in the region, to learn from each other's experience. So I once again thank the conference organizers and congratulate all the award winners, all the presenters and participants for their interaction. So thank you very much.
Thank you, Dr. Murhekar. And finally, I will once again invite Dr. Jih-Haw, the Director for Taiwan Centers for Disease Control, to give us some final thoughts.
Thank you. Dr. Murhekar, Professor Kirk, and Dr. Lim Ki-Zong, distinguished guests, ladies and gentlemen. On behalf of Taiwan Centers for Disease Control, I would like to thank you all for your participation and contribution to this important conference. And we are especially grateful to so many experts, as well as trainees and the graduate of FETP, to share important public health information. As we have learned different COVID-19 responses from each other, it is now time that we put into practice what we have discussed. Taiwan will host the 10th TAFINET Bi-Regional Scientific Conference in Taipei from May 31st to June 4th, 2021. We can continue the discussion we have started here at next year's conference. Thank you again for your participation, and I look forward to seeing you all in Taiwan next year. Thank you.
Thank you, Dr. Zhou. And that concludes our conference, and I hope to see everybody in Taipei next year. Thank you. And we should have a post-conference survey that's up on YouTube. And so please help us and fill out our post-conference survey. And we really would like to see you in person soon. Thank you.